Good afternoon, everyone. Hispanic Heritage Month, September 15 through October 15, is an important time of recognition and acknowledgement of the contributions of Hispanics and Latinos to this country. My name is Maritza Guzman Laureano, and I'm the Corporate Communications Manager here at Cook County Health, and I'm so happy to be here. Cook County Health is proud of the work we are doing to care for our patients and the Hispanic community as a whole. This includes growing the Latino enrollment in county care through multilingual outreach, building a healthcare workforce that represents our patient population through the Providence Scholarship Fund, expanding our bilingual renal clinic that supports patients pre and post kidney transplants, just to name a few. To learn more about us, you can visit cookcountyhealth.org. I'm grateful to all the people joining us today for this important discussion, including the daughter of Cook County Health's very own Dr. Jorge Prieto. Cook County Health's community health centers are a living testament to the legacy of Dr. Prieto, a pioneer physician and tireless advocate for social justice. Thanks to him, Cook County Health is able to bring the mission of this historic hospital into the communities. Before we get started with questions, I would like for everyone to briefly introduce themselves. Tell us about yourself and your experience. Let's start with Nancy.
Good afternoon. My name is Nancy Rivera. I am the Regional Director of Operations for the Northwest Cluster, which includes Jorge Prieto, one of my health facilities that I manage, North Riverside, Arlington Heights, Belmont and Cragen, and Morton East High School, and Austin Health Center. Those are the six facilities that I manage throughout the Cook County Health and Hospital systems.
Thank you. Guadalupe.
Good afternoon, everyone. So my name is Guadalupe Garcia, and I have the privilege of serving as Director of Language Services at Cook County Health.
Thank you. Carmen. You're on mute, Carmen. I'm sorry.
Sorry. Good afternoon. I'm Carmen Prieto. I'm not a medical professional. However, I am blessed to be one of the 9 children of Dr. Jorge and Luz Maria Prieto, and saw firsthand how they treated all human beings, which was with dignity and respect. I do want 2 of my brothers did become physicians, one at Cook County, Dr. Jorge Prieto, who was an orthopedic surgeon, and Dr. Francisco Prieto, who was a family practitioner in Sacramento, California.
That's amazing. Thank you so much. So let's start with the questions for today. Why don't we start by having you each tell me how you personally define culturally competent care and how you and your team are committed to helping Cook County Health deliver it. Nancy?
Cultural competency, it's really really an exciting thing that's happening around the world and even here at Cook County. I've been with the county for approximately over 10 years, a little bit 10 years, and I have seen it thrive. But cultural competence to me is it's an ability to connect and treat people in the cultural aspect that they would like to be treated. It's not that hard. So cultural competencies also is, knowing people's diversity, ensuring that they understand the culture where they're coming from, the values. All of that has so much to do with understanding the individual and also making sure that we value and respect their traditions so that we can connect with them in ensuring that we can provide them good health care and whatever they're coming in for. It can be as easy as a school physical to a trauma to whatever it is. It is extremely important that we connect with the patient at that point. So that's always been my driven, being able to commit and understanding and educating people on cultural competency.
Thank you. Carmen, do you have anything to add?
Yes. Culturally competent healthcare delivery is what my father practiced on a daily basis for more than 3 decades and is the basic approach of family practice medicine as we know it today, which he brought to Cook County Hospital, now Stroger, in the mid-70s. And Nancy, that was a beautiful definition of what I think, cultural competency means. It means to meet the patient where they are, whether it's in their neighborhood or their community, or even as my father did thousands of times in their homes by making house calls, often with my mother or one of us 9 children by his side. Medicine can't be and shouldn't be practiced as simply a formula or a treatment doctors learn from a book or a professor, and then apply said treatment. That is why in 1975, when he was asked to take the role, then the new role of chairman of the Department of Family Practice Medicine, he had the main condition he had was that clinics be established in the neighborhoods where the people came from to receive their health care. And that is why, Nancy and Guadalupe, your work is so important now.
Yeah, thank you. Thank you to your father for making that possible for us. Guadalupe, do you want to answer the question and say why it's important in healthcare?
Sure. So cultural competent to me means providing health services that are respectful and responsive to the culture and linguistic needs of every patient. Here at Cook County Health, our interpreter services team plays a vital role in making cultural competent care a reality. So we are committed to bridging language gaps so every patient can understand their care and express their needs clearly, and also by ensuring that language access is not a barrier to quality care.
Great. Thank you so much. The next question is for everyone. How has your own experience, either professionally or personally, driven you in your work today? We'll start with Guadalupe.
Oh boy. So for me, I've seen firsthand how language can impact healthcare. Early in my life, English was not my first language. And I often found myself helping my family communicate, especially my mom, who didn't speak English at that time. I do remember being that little bridge between the two worlds. One moment that will always stay with me was when I had to interpret for my grandfather. The doctor explained that his cancer treatment was no longer working, and that there was nothing more medically that could be done. I was young, but I knew the weight of those words, and I wanted to make sure he understood them with respect, honesty, and compassion. And to be honest, that experience changed me. It's shown me how powerful language is and how it can connect and comfort and bring dignity to the hardest moments. So that's what drives me today. It is why I care so deeply about language access and cultural understanding in healthcare, because I've seen what happens when patients can truly understand their care, and I never want anyone to have to face those moments without a voice or without support.
Wow, so moving, Guadalupe. Thank you for sharing that. I can actually relate to that. One of the things that brought me to Cook County Health too was, the importance of being able to translate for our loved ones when they're in a hospital bed, and now being in the communications department, I see how important it is to get materials in the language that the patient prefers. Godman, do you want to share a little bit about what drives you today? Drives your work. You're on mute.
I have been retired for a while now. As I said, I wasn't in the medical profession, but I did work in the nonprofit community in Chicago for almost 50 years. The last 30 years was with the Wiebold Foundation, where I facilitated support for multi-issue community organizing groups in the city. And the issues that these groups would address were, throughout those 30 years, were access to quality, affordable health care, immigration reform, public education, affordable housing. Those were, anywhere top 3. So that's how I came to it. And obviously through my family's history of social justice work, I've always been exposed to the importance of it.
Thank you. Nancy, how has your own experience driven you in your work today?
Well, interesting, Guadalupe. We have a very common denominator here. I think the fact that we came early into this country and we had to be our own advocates for our parents, our family members. Same thing happened to me as well. And with my mom, and it unfortunately, it also happened at Cook County. She was diagnosed with cancer um, at Cook County. And at that time, way like 30 years ago, or maybe more, we didn't have interpreters. So I was this child, I must have been 11, 12 years old, where I had no choice but vente hija, come on, you got to go with me to the doctor. And I'm like, oh my God, what am I going to do? So I had to go in and talk with, the doctors telling my mom her diagnosis of a cancer. Again, I didn't know, how to physically interpret at that point. I didn't know. I had no knowledge, but clearly I didn't know the vocabulary, the level of vocabulary that some of the providers or even nurses or, people were actually asking my mother. So I kind of winged it, and I have to admit there was times I didn't say the right things. I sugarcoated it because I didn't understand what this particular, you know, you know, vocabulary that they were using, and so it took me a while. And after that experience, giving my mom her own diagnosis, and the same with my father being sick, diabetic, you have to get in a diet with the nutritionist or the doctor, and you can't have the thin tortillas, and I'm like, oh my God, you can't like cut people off without tortillas, it's my part of my culture. So a lot of that really stuck to me, and I've always been an advocate, and so that's what drove me to pretty much healthcare and wanting to make a difference and making sure that we have people that understand what cultural competency is and how do you communicate. You don't need it to be an interpreter, but at least understand what people are saying in their own culture, in their own nurturing your what they're saying, and be sympathetic, empathetic on what they're saying, and how do we relate that. So that's been my experience throughout my career, and making sure that we advocate for interpreters if we need to have, we need to, but most importantly, how do we hire staff that are able to work with the population in which we're serving. And I think that is very crucial for me as an advocate, is that we need to make sure that our own staff understand the culture, understand the language. And if they don't understand, how do we get them to understand that?
Yeah.
So I'm very passionate about that as well. So.
Could I jump in there? I mean, that's exactly what you're saying. It's exactly what my father said, because it was a training hospital. It is a training hospital. Mm-hmm. And if he was going to train doctors that would then continue to serve in the inner cities, in these communities, they had to be there. And that's exactly what he did. And the first clinic that was open was in the Little Village neighborhood. And most of his residents, he would have 10 to 15 a year, learn to speak Spanish. I mean, it was a beautiful thing. So, and I know we're going to get to the question, but it's the beginning of building trust with a patient.
Let's just go straight to it. Tell us about building trust. How is it related to expanding access to healthcare? Carmen?
Well, because if someone is speaking to you in their mother tongue, I mean, that right there, the door opens, correct? And they might hear you better. You might listen, you will listen to them better. And then they will be able to tell you what is wrong with them. But it is a process. It's a building that trust. But that language competency is the first step to get there. And I will leave it to Nancy and to Guadalupe, who
Yeah.
are doing it now.
That's a perfect segue to my next question for Guadalupe. How do language barriers impact health, and how are we looking to close that gap for our patients?
So as I heard Carmen and Nancy said, language barriers can have a real and measurable impact on health outcomes. So when patients can't fully understand their providers, or when providers can't fully understand their patient, it leads to misdiagnosis, medication errors, and missed appointments, and even delayed care. But I think beyond the medical risk, it can also create fear and frustration and a sense of being unheard. What we often see is that patients who don't speak English might struggle with understanding instructions and how to take their medications. They may have trouble explaining their symptoms or concerns accurately. And sometimes something simple as scheduling a follow-up care appointment or a preventive service appointment becomes a challenge. So as you can imagine, I think the results in poor outcomes, higher hospital readmissions, and unnecessary complications. So here I feel we're proud. We continue to close these inequities by providing interpreter services. Not only do we have in person, we also have telephone interpreters and video interpreters that we provide over 250 different languages. And we also offer translated materials, consents, forms, and educational handouts. For us, interpreter services, our goal is simple. No patient should face a health challenge alone because of language. And by bridging this gap, we make healthcare more accessible and equitable and safe for everyone.
Yeah, we're continuing to build bridges. Thank you for sharing that. Carmen, you mentioned the Prieto Health Center a little bit ago. So just a few months ago, we were celebrating the 50th anniversary of the opening of the Prieto Health Center in Little Village, named after your late father. This center has been a shining example of Cook County Health's core mission to provide integrated, high-quality care to all residents with dignity and respect, regardless of their immigration status or their ability to pay. And since the opening of that clinic, we have expanded access throughout Cook County at all of our ACHN sites. Can you talk about how you felt attending this celebration and what it meant for you and your family?
Oh, I'm Mike, right? It was just made us so proud, and it was just so heartwarming to see that 50 years later, our father's legacy was, being lived every day. And it celebrated our father's vision of how healthcare should be provided to individuals and families in all communities, regardless of income or where they came from or where they were born. And it means that his legacy continues to this day, positively impacting healthcare, not only in Cook County, but in this nation and the world, because the residents he trained spread out all over the world and continue. So it just keeps on giving.
Yeah, thank you so much for sharing that. It was an honor to honor your father's legacy, and it was an honor doing the research as we prepared for the celebration, just learning more and more about the work that he did. We're so, so grateful. Nancy, the next question is for you. Are there any specific strategies that you found useful with your team to help increase cultural competence? Are you starting to see the impact on patients and their outcomes?
Absolutely. I think, like Guadalupe said, the fact that, we across the board, because, as a regional director for the Northwest Cluster, most of the particular locations that I'm the director of is the predominantly Hispanic community, from all the way from Arlington Heights. That's probably the most diverse community that we have right now from all aspects of life. One of the things is that we have been really excited about our workforce, the fact that we are able to hire staff based on the population that we are serving. And I think that that's really an exciting concept, the fact that we're, we're trying to target the population, whether if the population is Polish speaking, we try to get clerical staff, MA staff, nursing staff that will able to at least see somebody that they can connect. The same thing in our other community health centers. We really find that having the face of people that is represented within the community, it's really helping us not opening up our doors to access, but feeling them comfortable to come to us for the services that we need, what they need. So it really has looked at the impact. Again, as far as our strategies, it's always how do we get patients in and educate them that they need to change the ways of what they're doing. And I think when our staff can connect and say, necesito esto, or in their own language, it really does help improve access, improve their outcomes, improve that, if the staff, they see that a staff is culturally competent on a menu that they're presenting to a diabetic patient that now includes their, frijoles, their rice, and their tortillas, instead of cutting them all off, that would, that it's a great impact, right? Oh, but instead of the 8, comete dos, or something like. It's just such a good feeling to see that, oh my goodness, my diabetes went down, and or my blood pressure, they understand because you've talked to them in the language that they're most familiar with.
Yeah.
Maritza, you know how you say that, first impressions, first impressions are the most important thing, right? In whatever field. And you walk in and the receptionist or the first person you talk to smiles and speaks your language, the anxiety level will immediately drop. So there's the beginning of that building of trust and a positive relationship.
Completely agree. Thank you so much for sharing. Believe it or not, we're already at our last question. So to wrap up today's conversation, I'd like everyone to share with us a call to action that you leave our audience with. What do you want them to be thinking about as it relates to Hispanic Heritage Month? And we'll start with Guadalupe.
I would say my call of action would be for all of us to use our voice, our awareness, and our empathy and compassion to bridge gaps. By advocating for language access and celebrating diversity in our workplace, and recognizing the humanity behind every patient interaction. Honoring Hispanic Heritage Month shouldn't just be about the celebration, but it should be about action, inclusion, and equity in everything we do.
Thank you. Carmen.
Well, on an individual basis, I would say advocate for yourself and your loved ones, as Nancy and Guadalupe have been saying. Don't assume that the medical staff know, your culture that well. But so don't be afraid to ask questions so they understand what your needs are. And then on a more universal basis, advocate for healthcare for all to the extent that you can. This is what my father believed in, and that healthcare is a human right in a civilized society.
Don't be afraid to ask questions. Great. Nancy.
Wow, how can I tap that? You guys have said it all. So my call to action has been exactly what you both have said, is that we definitely need to, it should not just be celebrated, once a month, or any culture should not be just, but always, my call to action in the times that we are at now is to advocate, let people know what you feel, and make sure that, when you are encountering somebody of a second language, that you treat them with respect, you treat them with dignity, and you give them that opportunity to express themselves and what they need to do. Our language is nothing, anybody's language does not need to be hidden, but to be respected for what we are, because we all are immigrants and we all are advocates.
Really moving from all three of you. Thank you so much. That brings us to the end of the conversation. Thank you all for joining us today. Here at Cook County Health, we proudly celebrate Hispanic Heritage Month, honoring the incredible contributions of generations of Hispanic, Latino Americans who have enriched our country. I would like to thank you, our panelists here, for taking the time to be part of this amazing discussion. As always, we close with a reminder that at Cook County Health, we have proudly served generations of families and patients, regardless of their ability to pay, immigration status, or health insurance. This legacy actually began nearly 200 years ago with Cook County Health's first patient, a young girl who had recently immigrated from Germany and continues proudly to this day. Your health has a home at Cook County Health. And if you or someone that you know needs healthcare services, please call 312-864-0200 to schedule an appointment. Again, that number is 312-864-0200. All are welcome here. Thank you.